Endometriosis is a condition that's misunderstood, and many women suffer for years before finding out what's really going on. Doctors Trista Neuville and Jennifer Yagi with Pacific Endometriosis join me now to bring us some clarity on this important topic. Thank you both for being here today.
Of course. Thank you.
So I feel like we need to start with what is endometriosis? So let's start with you.
Yeah. So endometriosis, and often we just call it endo because endometriosis is a little bit of a mouthful, is a disease where tissue that resembles the tissue in the inner part of the uterus, which we call the endometrium, grows in places outside of the uterus. So most typically it's in the pelvis, but in some cases it can even be in the upper abdomen, and in really rare cases outside of the peritoneal cavity. The endometriosis can cause inflammation, which can cause pain. It can cause infertility, sometimes cause difficulty with bladder or bowel function.
Okay, and with those symptoms, is that when people should call their doctor and come in to get checked to see if this is something they might have?
Yeah. I mean, the most common symptom we hear about is just very painful periods. And, if there's one takeaway from today, it's if you're having pain with your period, that is to the extent where you're not able to go to school, not able to go to work, or not able to participate in general activities, that is not normal and should warrant an evaluation. But what's tricky about endometriosis is sometimes pain isn't the primary symptom, and for some patients it may be GI symptoms or even infertility that is the issue, and so that may be what leads them to our office for a consultation.
Okay, and Dr. Neuville, I want to get to you. What does your initial patient evaluation really include?
Well, it actually starts before they even get to the office. We start with reviewing their pretty thorough intake form and then reviewing medical history as well as other prior surgical history and any operative notes or pathology before they even walk in the room. Once they're at our office, we just do a deeper dive into symptoms as far as characteristics, location, onset, whether it's cyclical with ovulatory cycle or menstrual cycle, and then the physical exam portion of it.
Okay, and I understand you include free imaging with every consultation. How does that all work?
So the ultrasound is our most important tool in the office outside of our ears. After we do the hands-on physical exam, we do the ultrasound, which gives us time to look at the normal structures that would be seen in I guess you go to a radiology department. However, we're able to do it live. So we're able to look at the bladder, the uterus, the ovaries, as well as the spaces in front of the uterus, as well as behind the uterus in the cul-de-sac and at the large colon. We like to do a dynamic view where we push on the structures and see how the planes move separately to either increase our suspicion of endometriosis when it's not obvious, like endometriomas are within the bowel.
Okay, and Dr. Yagi, what makes your practice stand out too?
What is unique about our practice is we focus on surgically treating endometriosis, specifically through excision, which is different than ablation, which is what most general OBGYNs do or offer. Excision is essentially removing or cutting out the endometriosis wherever it's seen visually at time of surgery, or if we know about it beforehand based on imaging, versus ablation is burning or cauterizing that top layer of the endometriosis. So an analogy we sometimes use with our patients is think of endometriosis like a weed. And so if you're doing ablation, you're just mowing that top part or burning that most superficial part of the endometriosis. But with excision, you're really removing the disease or the weed by its roots. So you can imagine the chances at more complete pain relief and lower chances of recurrence are going to be through excision rather than ablation.
Okay, and I want to talk too, how do you guys treat ovarian endometriosis?
Yes, so ovarian endometriosis is more of a deeper infiltrating type of endometriosis where you can have a single endometrioma or you can have multiple different endometriomas. When they are present, the surgical approach is going to be more complex in general just because endometriomas can stick to the uterus, the sidewalls overlying the ureters as well as the bowel, and they're at much higher risk of having bowel wall lesions as well. When we remove them, we use the analogy removing the pulp from an orange. Once the entire endometrioma and cyst wall is removed, then we reapproximate the edges of the ovary to stop any bleeding, as well as to normalize ovarian structure. And that will reduce drastically chances of recurrence or the ovaries sticking to everything else in the pelvis.
Does this impact fertility then too? I know we touched on that.
Yes, endometriosis in of itself can, just because of the inflammation it causes. It doesn't allow the eggs and sperm to come together in a nice manner, as well as any pain that is caused from endometriosis. That will obviously reduce probably chances of fertility. That's why if any of our patients are working with a reproductive provider, then we really want to make a joint decision before we even go to the operating room, what's going to be best for the patient, their journey with reproductive fertility, as well as the surgeon.
Wow, I learned so much. Thank you so much, doctors, for being here today. We really appreciate it.
New Day Northwest is sponsored by Pacific Endometriosis and Pelvic Surgery.